So I'm going to explain about the costotransverse joint skeletal anatomy. As it says, the joint between the rib and the transverse process is the costotransverse joint. To locate this joint under ultrasound guidance, you will start to scan the thoracic spine longitudinally and moving laterally, looking for a gap between the transverse process and the rib. Once you have located this gap, the next step to do would be to move the ultrasound probe slightly horizontal, and you can then target or inject this joint using an out-of-plane technique. One of the ligamentous structures that are very important when you're performing this injection is the lateral costotransverse ligament, which you'll be able to identify on the ultrasound guidance, and targeting the joint with the local anesthetic and steroid. Volume would be maximum 1 ml of local anesthetic and steroid mixture using a 25 gauge hypodermic needle. You can also perform the injection in plane, but given the angulation, it can be more trickier getting into the joint using an in-plane technique. So my technique of preference would be the out-of-plane technique, going in to the joint and injecting local anesthetic and steroid. Thank you. I'm going to talk to you about the costotransverse joint injection. This could be one of the sources for posterior thoracic paraspinal pain. To start this, to do this injection, you will start with feeling for the spinous process, and you will put your probe horizontally or transversely on the spinous process. As you could see it in the image here, the spinous process is nicely seen. Then you will move laterally. As soon as you move laterally, you start to see the lamina. And then a point will come where you will start to see the transverse process in your image. Followed by this, you will also see the rib coming and joining onto the transverse process. And this is your costotransverse joint. The tip here, try to move the medial end of the probe slightly more caffalad, and this will allow you to look at the ligament, which is the costotransverse ligament, and this is the lateral costotransverse ligament, which is shown here in this image. This is the transverse process, it's a rib, and costotransverse joint injection can be performed in plane, coming from lateral to medial, going below the ligament. This ligament can also be the pain generator, so it's always sensible to inject in the ligament and also in the joint, and this will be the position of the needle coming in for the costotransverse joint injection. The joint volume is very small, so about 0.5 cc to 1 cc of local anesthetic and steroid mixture should suffice for this injection.